Namaskar, I'm Shubhendu Ghosh. Welcome to Tracking COVID-19. As the cases around the globe inch closer to the 2 million mark, in the next half an hour, we bring you all the updates and developments on the pandemic from India and the world. Let's begin with the top stories. Union Home Ministry writes to all states and union territories to ensure compliance of Supreme Court directions on welfare of migrant labourers, housed at relief shelters, availability of essential commodities under control as several ministries work in coordination with state governments to resolve logistical problems. Health Minister Dr. Harshwardhan holds review with Council of Scientific and Industrial Research through video conference about the steps undertaken by CSIR and its constituent 38 labs towards mitigation of coronavirus outbreak in the country, says CSIR scientists to develop COVID-19 mitigation solutions, keeping fixed time frame in mind. Active COVID-19 cases across India rise to 7,987 with 308 fatalities and 856 recoveries. Government focuses on increasing testing facilities, says no need to panic as the government is planning things effectively to manage the situation. Number of hotspots in Delhi goes up to 43 with more localities added as containment zones, high-risk zones and containment zones to be sanitized from today in the national capital. COVID-19 cases across the world continue to spiral up. Over 18,45,000 cases registered globally with over 1,14,000 deaths. US President Donald Trump signs presidential disaster declaration for all 50 states in wake of COVID-19, while the US records 1,514 virus deaths in past 24 hours. UK Prime Minister Boris Johnson discharged from hospital. Let's first take stock of developments in India in Ground Zero. Now, India's response to contain COVID-19 has been proactive, and the government has followed a graded approach focusing on increasing testing facilities. The government has said that there is no need to panic as proper planning is being done to effectively manage the situation. Further, in coordination with the states, the centre is ensuring supply of PPE, N95 masks, testing kits and ventilators along with dedicated COVID hospitals are also being set up to provide proper treatment. The figure of active cases has risen to 7,987 with 308 fatalities and 856 people discharged so far. And we'll be looking at the different situation across the country as well. Remember, Maharashtra is one of the worst affected in the country. Meanwhile, in view of the Supreme Court's directions regarding welfare of migrant labourers housed at relief shelter camps in different parts of the country, Union Ministry of Home Affairs has written to all states and union territories to take necessary action in compliance with directions of the Apex Court while implementing lockdown measures to fight COVID-19 effectively. Now, the court directed that adequate medical facilities besides proper arrangements for food, clean drinking water and sanitation be ensured for migrant workers at relief camps and shelters across the country. Further, trained counsellors and community group leaders belonging to all faiths should visit the relief camps and shelter homes and deal with any consternation that the migrants might be going through. The court also observed that the anxiety and fear of the migrants should be understood by the police and other authorities, and they should be dealt with in a humane manner. Meanwhile, Union Health Minister Dr. Harshwardhan yesterday held a review meeting with the Director General of Council of Scientific and Industrial Research, Shekhar Mande, and all 38 CSIR lab directors. During the meeting, Health Minister exhorted scientists to develop COVID-19 mitigation solutions, keeping a fixed time frame in mind. He added that these are times of war and we need to deliver solutions before the war ends by not treating this as a routine research project. Dr. Harshwardhan said genetic sequencing was crucial in eradicating polio and it will help in COVID-19 mitigation as well. During the meeting, CSIR DG said a core strategy group has been set up and 5 verticals have been identified under which coronavirus-related activities are being carried out. These include digital and molecular surveillance, rapid and economical diagnostics, new drugs, repurposing of drugs, associated production processes, hospital assistive devices, PPEs, supply chain and logistics support system, among others. Dr. Mande also mentioned that 15 CSIR labs are working in close partnership with major industries, PSUs, MSMEs, and other departments and ministries at the time of crisis in the country. The Health Minister appreciated that CSIR labs are also conducting tests of swab samples of coronavirus patients. Some of them have started doing genetic sequencing of the virus with the target of doing at least 500 sequencing in the coming weeks. He also appreciated the work done by CSIR NAL with BHEL and BAL on ventilators, oxygen enrichment devices, and are also being developed 3D printed face shields, face masks, gowns and other protective equipment, adding that all these things will help us crucially in the next few weeks. The Delhi government has identified 3 more areas as containment zones in the capital. The number of containment zones in Delhi now stands at 43. Southeast Delhi has the highest number with 12 containment zones. The total coronavirus cases in Delhi has risen to 1,154. This is according to the latest data from Ministry of Health. 24 people have died in the state so far from coronavirus, while 27 have been cured and discharged. We get some more updates from the ground. Meghalaya's defences have held strong against COVID-19 onslaught, and the state is currently one of the only 2 in the country that is yet to report a single infection. With the state government implementing a lockdown that was more restrictive than the rest of the country, challenges facing the public were many, but the public response has so far been equal to it. Here's a report on one such response.
We're approaching the fag end of the 21-day lockdown in Meghalaya, and the state has been holding its own. Integral to any success the state government can lay claim to is the role of the delivery executive, especially in the initial few days when essential commodity shops were all shut. It's the delivery executive that stepped up to fill this role. We've managed to catch up with one such delivery executive, Mr. Benny Lingdo, and let's find out how he has handled this challenge.
We started this thing 2 days within the lockdown, so we approached the government and all to do the formalities and all, but it took us 2 days to start operation. We had never done like this, anything like this in Meghalaya. So after some time, we got used to it, but then by that time the deliveries have also, like, people have settled down and all that. So meaning there's no more panic buying and all.
It is the ordinary people like Benny Lingdo who saw opportunity in the crisis and helped the Meghalaya government tide over this challenge. This only goes to further show that it is the cooperation and determination of the ordinary people that is integral to the success of any government venture. Reporting for DD News from Meghalaya, this is Gautam S. Kumar.
And in Rajasthan, with 10 more positive cases from Bharatpur, the positive figures continue to rise in the state. Social distancing is the only mantra as the state plans to look beyond the lockdown. My colleague Vishal Baristo gets us more detail from Rajasthan.
Ruthless containment of virus continues in Rajasthan as the government is now contemplating on modified lockdown, which means that cinema halls, schools and colleges will remain closed, but mobile shops and restaurants with online delivery will now be allowed to function. And along with that, mask will always be compulsory. Vishal Baristo for DD India, Jaipur.
In the wake of the rising number of novel coronavirus cases in the country, the nationwide lockdown has also been on. Government of Jammu and Kashmir is taking all the necessary measures in its capacity to provide essential commodities to the masses.
In view of the lockdown, the J&K UT government is taking all the measures which it can do for providing essential commodities to people. Now the poor people of the UT will be provided 5 kg ration free from food and supplies depots. This will be in addition to the 2 months advance ration being provided to the people in the Union Territory. Talking to Food and Supplies Director Jitendra Singh, he said that the 5 kg free ration will be provided to the poor people from tomorrow.
On the directions of the government, हमें 2 महीने का राशन जो है अप्रैल और मई का वो हमने डिस्ट्रीब्यूशन उसकी स्टार्ट कर दी है और एज ऑन डेट कल शाम तक जो जब मुझे रिपोर्ट आई लगभग 5:30-6 बजे तो हमारे लोगों ने अप्रैल और मई का जो राशन था वो लोगों तक बेनिफिशियरीज तक जो है वो पहुंचा दिया था। इसी तरह से हमारे डिवीजनल कमिश्नर साहब जो कि रेड क्रॉस के डिवीजन के चेयरमैन हैं उनकी हिदायत पे हमने 1500 क्विंटल राइस और 1500 क्विंटल आटा जो है हमने डिवीजनल कमिश्नर साहब के थ्रू हमने रेड क्रॉस को दिया है जो कि वो लेबरर्स और जो डेली वेजर्स जो हैं उनको वो प्रोवाइड कर रहे हैं, फ्री ऑफ कॉस्ट है ये।
Government has almost complete distribution of advance 2 months ration for the months of April and May among the beneficiaries within a short span of 6 days across all the district of Jammu division. Furthermore, Food and Supplies Department has kept 1500 quintals of rice and 1500 quintals of atta at the disposal of Red Cross Society Jammu for distribution among the poor and stranded laborers and daily wages free of cost. It is evident that Union Territory government is taking all the steps to ensure that ration and other essentials are provided to people at this critical juncture. R.K. Rana for Dairy India from Jammu.
Now, a rumor is being spread these days bothering the customers of State Bank of India. In the viral post, it is being claimed that Reserve Bank of India (RBI) has shut down the State Bank of India's Aadhaar-enabled payment system or AEPS server. Now, PIB fact-check team has dismissed the message. PIB stated that this claim is false. No such decision has been made by RBI. RBI has not shut down the server of Aadhaar-enabled payment system of State Bank of India. All the viewers are requested not to pay any heed to any such fake news and do a fact-check from official sources. The Ministry of Health and Family Welfare has dismissed the media reports stating that Preconception and Prenatal Diagnostic Techniques Prohibition of Sex Selection Act 1994 has been entirely suspended. The ministry has clarified that only some relaxation has been given to submission of reports in view of the coronavirus lockdown. The rules pertain to applying for renewal of registration if falling due in this period, submission of reports by diagnostics centers by 5th day of the following month, and submission of quarterly progress report by the states and union territories. The submission deadlines of reports to respective appropriate authorities have been extended till June 30th, 2020. We now bring you some news that inspires hope in the fight against COVID-19. The government is taking all the steps to provide relief to the poor and underprivileged sections of society. Kisan schemes like Samman Nidhi Yojana, Ujjwala Yojana are proving to be a blessing in particular. Money is being transferred to the beneficiaries under Pradhan Mantri Jan Dhan Yojana, after which they express gratitude towards the government.
मैं और मेरा परिवार प्रधानमंत्री जी द्वारा चल रही सभी योजनाओं का लाभ उठा रहा है। मैं किसान सम्मान निधि योजना के तहत 2000 रुपए की और मेरी मां उज्ज्वला योजना के तहत 793 रुपए, साथ ही विधवा पेंशन के रूप में 1500 रुपए, मेरी पत्नी को गरीब कल्याण योजना के तहत 500 रुपए और भारत सरकार द्वारा भेजी गई सहायता राशि घर बैठे बैंक के जरिए प्राप्त की गई है, जिसके लिए मैं भारत सरकार और साथ ही साथ बैंक वालों को धन्यवाद देता हूँ।
हमारा नाम वर्षा है और हम घाटमपुर तहसील के रहने वाले हैं। और लॉकडाउन की वजह से, जो कोरोना महामारी की वजह से लॉकडाउन हुआ है, सब कुछ बंद है, हम लोगों को पैसे की दिक्कत थी। इसकी वजह से जो सरकार ने पैसा भेजा है उसके तहत पिताजी के वृद्धावस्था वाला पैसा आ चुका है उनके खाते में, और माताजी के खाते में जो गैस सिलेंडर का पैसा था उज्ज्वला गैस सिलेंडर वाला वो आ चुका है, और हमारे और भाभी के खाते में जो गरीब महिला परिवार कल्याण का पैसा आना था 500 रुपये वो आ चुका है।
मेरा नाम सुनीता देवी है। जनधन में 500 रुपया मिला है, उसको मैं साग सब्जी जो घर का खर्च था किए। उसके बाद वृद्धा पेंशन भी मिला है, उससे भी दवाई दारू किए हैं, और गैस सिलेंडर भी मिला है, उस पे घर में बनाकर खा रहे हैं और वायरस से बचने के लिए घर में रह रहे हैं।
From early detection to curbing COVID-19 from spreading further, several districts have been adopting innovative models for the same. The Agora model has emerged as the best model so far for successfully tackling cluster containment. The state, district administration, frontline workers coordinated their efforts by utilizing their existing smart city integrated command and control center as war rooms. Under the cluster containment and outbreak containment plans, district administration identified epicenters, delineated the impact of positive confirmed cases on the map, and then deployed special task force as per the micro plan made by the administration. For reaching out to people, central helplines were established. A multifunctional team was set up for coordinating responses. The cluster containment strategy adopted by Agora is being shared with other states as a best practice.
सर हमारे पास फूड पैकेट से रिलेटेड आती हैं जिसको कि हम नियरेस्ट थाना होता है वहाँ पर हम अपनी कॉल फॉरवर्ड करते हैं।
सर यहाँ जो कॉलें आती हैं वो राहत सामग्री को लेकर के आती हैं और जहाँ गैदरिंग होती है उसकी सूचना दी जाती है, तो हम लोग तुरंत अपना जो है पुलिस कंट्रोल रूम जो हमारा बना हुआ है उसको सूचना देते हैं और उसके बाद वहाँ से पुलिस मूवमेंट कर जाती है। जहाँ भी गैदरिंग होती है वहाँ जाकर उनको तितर बितर कर देते हैं।
सर हम लोगों के पास कोई कॉल वगैरह नहीं आती है। जो लोग रोड पर निकल रहे हैं, फालतू लोग निकल रहे हैं बिना बेवजह के, उनके हम लोग चालान बनाते हैं।
अपनी भी समस्याओं के लिए कॉल आते हैं, खाने की है या दवा की है, जो भी आती है तो उनको जो हमारे पास जीएमओ का कंट्रोल रूम नंबर है वो नंबर उनको उपलब्ध करा दिया जाता है या फिर कंट्रोल रूम को फ़ोन करके उनको बता दिया जाता है कि इस फ़ोन से आया राशन की है तो डीएसओ फ़ोन कर दिया जाता है उनको।
Innovation showing result. Meanwhile, in Bengaluru, Department of Health and Family Welfare, Karnataka, shared an impactful and beautiful visual with positive message. A team of doctors joined together in thunderous applause to give a farewell to a COVID-19 discharged patient. The team of doctors at KC General Hospital in Bengaluru were seen clapping joyfully as the CEO of the patient who had recovered. Doctors wished him well, cheered him and presented him with a bouquet and reached out to him, bidding a smiling farewell. That's the spirit of the doctors treating COVID-19 patient. The patient was clearly overwhelmed as well. In their efforts to curb the spread of novel coronavirus, All India Institute of Medical Sciences AIMS Rishikesh has come up with a new device and software to detect and create awareness about the symptoms related to novel coronavirus. This software that can be downloaded in the form of an app will connect with the person directly to the database of AIMS as soon as the person fills the details, upon which the app will provide all necessary health provisions based on preliminary details filled by the user. In addition to the software, a device that can either be worn on wrist or waist, which will enable the physician to monitor the patient's health on timely basis. The device will also help in commuting the patient through an ambulance when and whenever needed. The soon-to-be-launched software and device has been developed by Bharat Electronics Limited, BEL.
सॉफ्टवेयर एक ऐसा सॉफ्टवेयर है जिसको एक मोबाइल एप्लीकेशन के ज़रिए कोई भी पेशेंट अपने मोबाइल पर डाउनलोड कर सकता है और उसमें एक छोटा सा फॉर्म अपने मोबाइल नंबर को वेरीफाई करके ये बता सकता है कि उसको कोविड के लक्षण उत्पन्न हो रहे हैं। इस तरह से वो एम्स से जुड़ जाता है। हमने एक डिवाइस बनाई जो हमारा हेल्थ केयर वर्कर उसके घर पर लगाने जाएगा, ऐसा हमारा प्लान है, और उसके ज़रिए हमारे उसका पेशेंट का रेस्पिरेटरी रेट मतलब श्वास गति, उसके ब्लड में ऑक्सीजन की कितनी मात्रा है, इसका अनुमान और उसका बुखार, ये मुख्यतः 3 ऐसे पैरामीटर्स हैं जिनको हम कोविड पेशेंट्स में देख रहे हैं। ऐसे पेशेंट्स को हम उनके घर पे ही डिवाइस देंगे और वो पूरी तरह से अपने इन सिम्टम्स को हमारे कंट्रोल सेंटर में दिखा पाएंगे।
Now, in a special goodwill gesture, India has gifted 5 lakh tablets of hydroxychloroquine to Afghanistan to fight COVID-19. Besides 251 containers carrying the first consignment of over 5,000 metric tons of wheat out of the total gift of 75,000 metric tons was also sent to Chabahar port from Kandla port on Sunday. The remaining consignments will also follow in the weeks ahead. And Rio de Janeiro statue of Christ the Redeemer was lit up on Easter Sunday with images of medical workers in honor of all those fighting the COVID-19 pandemic around the world. The giant statue of Jesus Christ that stands nearly 100 feet tall overlooks the city of Rio de Janeiro was also visible, Christ wearing a doctor's uniform. Time for some more international updates in World Wrap. The number of coronavirus cases continue to rise across the world. Over 18.48 lakh people have been infected across the world due to it. The death toll has crossed the 1.14 lakh mark. The data is undoubtedly grim, but it cannot also be overlooked that more than 4.31 lakh people have also recovered from the disease, with over 20,000 casualties in the US. United States has the highest number of fatalities, followed by Italy, Spain, France and the United Kingdom. Now, the United States, that has become the outbreak's new epicenter after China and Italy, eclipsed the total number of cases in Italy and Spain as the country's confirmed cases reached 5,56,000 and above, and the deaths surpassed the 21,000 mark as it records 1,514 virus-related deaths in the past 24 hours. US President Donald Trump has declared a national emergency, and all 50 states have been notified with major disaster declaration, as more than 95% of the country's 330 million population are under stay-at-home order. Meanwhile, US church leaders pepped their Easter gatherings, keeping in mind coronavirus directives.
Good morning and happy Easter. Christ has risen.
And Italy on Sunday reported its lowest coronavirus death toll in more than 3 weeks. The 431 new deaths reported by Civil Protection Service were the lowest since March 19th. Italy's death toll now stands at 19,899. That's the second behind the United States. According to officials, the number of people currently showing COVID-19 symptoms is still growing and has reached 1,02,253. However, number of people receiving emergency care has dropped. The number of people in non-critical hospital care has also seen a significant decline. Italy, remember, was the first Western democracy to be hit by the virus, and its lockdown has now been extended until the beginning of May. And Spain's coronavirus death toll rose for the first time in 3 days on Sunday. A total of 619 people died over the past 24 hours, bringing the cumulative toll to 17,209. Confirmed cases increased by around 2.6% to 1,66,831. Tough lockdown measures have helped bring down a spiraling death rate that reached its peak in early April. Meanwhile, all non-essential workers had been told to stay at home, but the government plans to revert less strict curbs that were in force up to March 27th. And in United Kingdom, the death toll from COVID-19 rises to 10,612 across hospitals in the country after it recorded a daily rise of 737. The total number of infected cases has risen to 85,206. Meanwhile, British Prime Minister Boris Johnson was discharged from hospital yesterday. Johnson was taken to St Thomas's Hospital in London on April 5th. He was then moved into intensive care unit the following day and remained there until April 9th. Some updates from our neighborhood. Nepal has reported 3 new cases of coronavirus. With this, the total number of cases has gone up to 12 in the Himalayan nation. Ministry of Health and Population spokesperson said that condition of all 3 patients are normal and they are undergoing treatment in Birganj. He also informed that 5,184 tests have been conducted in the country so far, including 795 sample tested in the last 24 hours. Bangladesh Prime Minister Sheikh Hasina announced 5,000 crore taka special subsidized loan package for boosting agricultural production in the aftermath of the corona crisis. Prime Minister Sheikh Hasina said that a refinancing scheme of 5,000 crore taka will carry a maximum interest rate of 5%. She said that small and medium farmers will particularly get benefit from this loan. This fund to use as current capital for use in agricultural and related activities. Earlier on April 5th, the government of Bangladesh had announced a subsidized loan package of some 72,000 crore taka for various other sectors of the economy. And time now for some expert advice on COVID-19. And today, Assistant Professor of Medicine at VMMC and Safdarjung Hospital, Dr. Rupali Malik, tells us about the right way to wear mask and how to avoid any kind of leakage.
Whenever we wear the mask, we should see that pleats should be facing downwards. Otherwise, whatever secretions are coming out of your respiratory tract will get entrapped in those pleats and they will make your mask wet. Now, another thing is, after wearing the mask, you have to ensure that there is no leakage. Always after wearing a mask, you should try to breathe in and breathe out and see if there's any air leakage. Because if there's any air leakage, the purpose of wearing the mask gets defeated. And once you have worn the mask, always make sure that you should not be touching the front portions of the mask with your hands.
And with that, we conclude this special edition of Tracking COVID-19. Practice personal hygiene and stay safe at home. Namaskar.